Hi all. First, I just got to let you know that obviously, given the circumstances at the moment, you can. It's probably the same way you are. There's lots of people that are home that wouldn't ordinarily be home. So if you can hear drumming in the background, it's very good drumming. It just happens to be from next door. What can you do? People are at home now, so if I wait for the drumming to stop, I could be here until hopefully COVID-19 would have been long gone. So I'm just going to crack on with it, and I hope that's okay. Thanks very much. So, with the drumming warning out of the way, what could we be talking about at the moment? Firstly, what I wanted to do was to try to get across the World Health Organization's recommendations. I find the World Health Organization to be the best to go to for their information. It's clear, it's concise, there's no politics involved in it. So that's why I'm choosing to use them. So the first thing that is recommended is to obviously stay aware of all the latest information to do with COVID-19. That's available on the WHO's website, and it'll also be available to you through your national and local public health authorities. Now, this is obviously going to vary from person to person, dependent on where you are in the world. The one thing that will be constant will be the World Health Organization's website. I'll put links in the descriptions below, and also there should be something up there that describes it as well. So, most people who become infected are going to experience a mild illness. My understanding what mild means is very heavy, serious cold, and can be as bad as influenza. Now, that's that's not to be sniffed at. No pun intended. But it can be more severe for others. So, how are we going to take care of our health? I'm sure you've had this morning, noon and night, no matter what your preferred way of consuming news is. It's wash your hands thoroughly. There are essentially two ways of doing that. The less popular or likely one for us is going to be using an alcohol-based rub. But what is good enough is what most of us do every day of our lives anyway, which is washing our hands thoroughly with soap and water. The other main thing that we can do is maintaining social distancing. Now, I know most of us will have heard of what social distancing is, but perhaps we're not quite sure of what does it mean, what do I have to do, or what don't I have to do. So social distancing is maintaining at least 1 metre or 3 feet of distance between yourself and anyone who is coughing or sneezing. And I think that's the important thing. Another thing that we can do for ourselves is avoid touching our eyes, our nose, or our mouth. We also have to practice respiratory hygiene, and we also need to make sure that those around us are following good respiratory hygiene as well. So this means covering our mouths or noses when we cough or sneeze. And then if we're using a tissue, dispose of the tissue immediately and safely. More importantly, and perhaps more severely, if you are experiencing fever, a persistent cough, and you have difficulty breathing, you need to seek medical care, and you need to seek it early. Obviously, if you're feeling unwell, you should be staying at home anyway. But nonetheless, let me just remind you, stay at home. You also need to try and seek that advice as early as you can. It's difficult to seek it in advance of knowing that you're going to get it. But if you have a sensation that there's something not right, that you know this is leading to something, then I think it's right to phone whatever the primary care line. So for us in the UK, there's a multitude of ways that we can get medical advice. And again, unfortunately, if I was to go through everywhere in the world, we'd be here for a month of Sundays. There's no one going to know your local situation like you. So please take time just to find out who you need to contact in the event of feeling really bad and exhibiting these symptoms. We're going to, at some point, get direction from our local authorities, although arguably in a lot of the world, that's where a lot of the direction's been coming from, as opposed to governmental level. So we need to know where we can get that information, and we need to act on it. We also need to follow the advice that we're given. There's no point in scientists and doctors giving us advice, the best advice they have to give right at that moment in time, if we don't take heed of that. I think that people are starting to come round to the notion that they need to practice social distancing, obviously the washing of the hands thing, and those that are unwell, staying at home. I know that not everybody, in fact the majority of us, can't afford to just not go to work. But I guess when we weigh it up, it's a case of, well, I'm going to have to lose some money now, but at least I'm going to be around to make a couple of quid in the future and look after my family. And besides, you're no good to them ill. Okay? The WHO are doing a great job of getting information and data out to not just the media, but the general public as well. One way they communicate how the world is faring during this pandemic is through what they call a situation dashboard. They run these dashboards all the time, so that the likes of you and I can go and look data up. We can see, what are the areas that are affected, what's worse affected than somewhere else, and it gives you, I wouldn't say it's real time, because obviously they have to collect the data in the first place, but it's very, very good. It's very relevant to where you are right now. For anyone who's going to look at that data on coronavirus in particular, you can see that it's split down by countries. You'll also notice that if you have a look at the shape of the data for each individual country, over the first 4 to 6 weeks of there being people infected in those countries, it's a kind of flat curve. It starts off obviously in single figures, that lasts for a week or two, and then it bumps up to, obviously in the tens, but that lasts for about 4 to 6 weeks. After that, people need to buckle up, because as we start to move into the next 4 to 6 weeks, those cases and the data take off like a rocket. As frightening as this may appear, and it is scary, we're seeing wall-to-wall coverage, 24 hours a day, 7 days a week, based on something that's brand new to science and medicine. Certainly we in the UK, like much of Europe, we've got expert care in the form of universal healthcare. We don't consider, what would it be like if I'm going to become unwell? Have I got the right insurance? Have I got enough insurance? We just turn up or pick up a phone, inform someone that we are desperately unwell, and we make use of that system. So will that be enough to take care of absolutely everyone's needs? Well, we don't know. And it's, without wanting to frighten anybody, it's not likely, because the healthcare system isn't built for a pandemic. It's built to take care of what ordinarily we would expect to experience in terms of illness. However, thankfully, we have this system in place, and it's available to everyone here, whether or not they've got private health insurance. In my country, in the United Kingdom, yes, you can have private health insurance, but it's not a choice between the two. Essentially, if you want to have privileges or things available to you during your healthcare that you wouldn't ordinarily have from nationalised healthcare. Yeah, you can have that if you want. But our NHS, our nationalised health system, is marvellous. The people within it are marvellous. I might be a bit biased there. I won't tell you why. So the issues I've got is, I've certainly got my problems and concerns over the way that the Johnson administration particularly has communicated what's been going on with the pandemic. However, across the Atlantic, there's a show being put on that would make a Marx Brothers film look like SEAL Team 6 planning their next covert operation. So I know what you're thinking. Well, I don't, do I? But why am I bringing up the US? Dave, why are you bringing up the US? And their response, when there's plenty to talk about here at home. Well, yeah, there's plenty to talk about here at home. But pandemics aren't singular. They don't stop at country borders. We need to look at everywhere and everybody. And life doesn't stop. And hopefully you'll come to see why this is, of concern, not just to me, to other people, and I think it should be of concern to you as well. So I find it staggering that the richest country on the planet has made, objectively, what can only be described as the worst job possible of dealing with this particular problem, when they have they have their fair share of experts, people that know what they're doing, know what they're talking about. So why such a problem?